This discussion for me has been very painful. Every time we talk about this subject, I see my brother in his coffin because it was only 4 years ago. And I think that we're talking about some of the key links that are missing in the entire treatment and recovery process. And the process is what we need. So I applaud Blue Guardian. I think that the step-by-steps that you showed, the linkage between Narcan and treatment is fundamental. I see it in our county, Indiana County. And Narcan's saving lives, but we've got to get to the point where we don't need to continue to provide Narcan. I think we need to do this discussion let's start talking about prevention as well. I think that's where we need to be at some point. But 5,000, 5,400 lives lost every year is to me, there's no cost that we should have to be worried about to cover this, because the cost to our communities, the cost to families. I know what it did to my parents. I know what it did to our family. Representative Gregory, I understand Jim's point as well, and everyone who suffers through this. So it's very pertinent that we have this discussion. I applaud Representative Heffley for pushing these legislations forward. But I have a couple of questions, I think, pertaining to, first of all, Blue Guardian. I know we want to keep this brief because we're running out of time, but how has that program been received in the community?
It's been received very well, actually. And since we've incepted the program, we've seen a shift in perception from the community about law enforcement. They see them there as now to help, not to arrest. And we see a shift in perception from law enforcement with regard to what addiction is. It's not the face you think you used to know. It's constantly changing. So there's been some very positives that's come out of that.
And is it funded through the district attorney's office or through, go ahead.
It is a combination of the district attorney's office for his staff and support, but it's also funded through single county authority.
Okay. The stigma is still a big concern for me, and I think the stories that you told, some of you today in your testimony, you got to put a face to this, because these are people who simply made a bad decision, or like my brother had a sports injury that led them down the wrong path. So I think if we want to erase the stigma, and the stigma is a big thing, I really think we need to change that. And you mentioned it, Dr. Barbera, in the emergency room. And as we talk about the warm handoff, which again I think is essential, it needs to be warm, right? We can't have nurses and doctors who don't understand this as well. And I've heard that story as well back in my home county. So we need to make sure that as we push this legislation forward, I think all the items in here are so important. I think that's the only couple of questions that I had. Just one more related to the registry. I did share that with some of our treatment professionals in Indiana County as well, and they sort of agreed that there isn't a lot of value in it if it's not accurate. So that's just something that I think we need to bear in mind moving forward. So again, thank you all for being here. Thank you.